Thank you all for coming. This is a very special lecture we have tonight, and my job is to introduce the introducer. I'd like to take this opportunity to introduce Dr. Brian Sippy. Dr. Sippy is an ophthalmologist, and he's been a very active person in the global public health area. He's trained ophthalmologists in both China and in Syria. And he's given at least one or two lectures, I think, in the Global Public Health Lecture Series that are online on the Global Public Health webpage if you're interested in that. Before I turn it over to him, I just wanted to say that he's the co-chair with Nancy Fitch, who is seated next to him, of the External Advisory Committee for the Global Public Health Program. And in that capacity, we first discussed the fact that Professor Janes was going to be coming to Montana to do the site visit for the program. So he's the external program reviewer, and so he's been busy every minute of the last 2 days meeting with people about the program. And Brian said, why don't we ask you to do a lecture as well? So it was all Brian's idea. So Brian, let's start.
Thank you, Peter. Well, it is my pleasure to introduce Dr. Janes. He's going to have his lecture videoed with MCAT, just like all the other series in the spring. And so if any friends or colleagues are unable to attend tonight, it'll be posted shortly after editing. I want to thank you personally for making this trip from Canada down. This program is going through a very important transition as the university is going through a transition. And when you look at the hierarchy of the powers that be and the politics of the university system, one of the things that they've set their, their staff down on is, global exchange with the University of Montana. And global public health fits into almost every aspect. If it's resource extraction, if it's, policy making, it comes down to humans. And so his visit here is hopefully going to help this program show a strong argument for prioritization during the restructuring and the kind of financial issues that we're dealing with here at the university and in Montana. So, not to give you his entire bio, he has a lengthy bio, but let me summarize. It's always nice to know kind of where he's been, and then we'll end up on what he's going to talk about. So he started his Bachelor of Arts training at the UC system in San Diego, and then stayed with the UC theme and did a master's in Colorado, at UC Colorado, and then back up to UC Berkeley in the Bay Area for his PhD, and finished that in the mid-'80s. Not long after that, he then made his way back to Colorado and became faculty and ultimately the chair of their anthropology department, and became a founding director of a health and behavioral sciences program there in Colorado. Eventually then he made his move to Canada near the Vancouver area at the Simon Fraser University there, and ultimately ran the global health programs at the master's level up to the PhD and MPH levels, and became an associate dean of the faculty. So not only continuing his work with students, but starting to get more administratively. This ultimately led him to Mongolia, looking at the climate disasters that were happening and how it was impacting the households in rural Mongolia. And an interesting aside that he came across during this decade of work over there practically was an uprising of the mining industry in Mongolia, and a lot of it was being backed by the Canadians. So he's working at a Canadian university, he's witnessing a place clear across the world being impacted by resource extraction, but went there to deal with climate issues on the population. But again, it all ties together. Eventually wrote a book with his students and was awarded a National Medal of Honor from Mongolia for his work and his advocacy there for them. Has been now recruited a little bit further east over to the Great Lakes area, works in Southern Ontario, director of the School of Public Health at the University of Waterloo. And what I caught my eye was that he's leading an initiative there to create a cross-departmental institute in global health research and innovation. That's what we're trying to do here. cross-departmental strength and have a wide foundation and a wide base and pull on the same rope. Eventually, he has gone to Africa now, and we're going to hear about his most recent endeavors with colleagues in Zambia. And from there, I'll turn it over to Dr. James for our lecture. Thank you, sir.
Well, thank you very much, Brian. It has been kind of a long journey listening to all that, and you always wonder how you got here from there. I'll talk a little bit about that. Brief disclaimer at the beginning. I will talk a little bit about satellites and about GIS and a few other things. And the disclaimer is that I'm not an expert in any of those things. I know a lot about them, but so if you have technical questions, I can't answer them. But I can talk a lot about why they're important and why they're useful. And I think highlight the important theme, I think, that'll run through this presentation of how important interdisciplinary work is in global public health. It's one of those fields where the ties together biology, the natural sciences in general, physical sciences also, climate. We'll talk a little bit about hydrology and bathymetry and a few other things like that, along with just anthropology and communities and culture and things like that. So it's a nice sort of, I think, overview of really the importance of interdisciplinary training in global public health, which is really a hallmark, I think, of the minor here. So a little bit about my journey from Mongolia to Zambia. You heard a bit about my work in Mongolia. I was actually working there for about 20 years. And as Brian mentioned, when I moved to Canada, when it was about 2005, and as I was doing my climate change research, I kept tripping over these Canadian mining companies and these Canadian miners. And it turned out that Canada was, after China, the largest international investor in Mongolia, mainly in mining gold, some copper, some massive mines on the border with China. And it became clear to me that somebody needed to be looking at what the Canadians were doing internationally. I learned that Canada is the world's miner. I think 60% of all the major international mining companies are registered in either in Vancouver or Toronto. So it's a major kind of industry there, and I became very interested in that. But as part of that work, I began to talk to my colleagues in Canada who might be interested in this, and I came across this organization called the Canadian Coalition for Global Health Research, which was sort of a loosely organized group that was very interested in really promoting ethical research abroad. And by ethical research, it's research that focused on partnering and creating equitable partnerships with people in the countries where we were working, about trying to harmonize activities. I think many of us have had the experience, if those of you who've worked internationally, of stumbling over somebody in an airport in Kampala, and you think, oh, well, why are you here? Why are you here? And Canadians, we kept tripping over one another in these different foreign countries and realized that, it might be a good idea for us to talk to one another and find out what one another is doing and maybe learn from one another and maybe harmonize some of our activities, build some teams, and that sort of thing. And so that essentially is what got me to Zambia, because the coalition had been working in Zambia for a number of years with partners there and trying to harmonize some of the Canadian researchers who were working in Zambia. And they invited me to join this group. And Zambia it's not Mongolia, but it's a really interesting place. And I think that there's a lot there that is similar to what your experience has been in Mongolia, including lots of Canadian mining companies, particularly up in the copper belt. So that's really what led me to Zambia at that time. But of course there you meet people, you develop relationships, you do a lot of things that exposes you to sort of what some of the issues are in the country. And that's really what led to what I'm going to talk about this evening. But here's just a bit about the Canadian Coalition on Global Health Research, and this is its mission statement. That you can see, and it's about health research, and I think this is important. So the coalition is not an NGO that delivers services. The coalition is about really fostering the capacity of countries to actually do research and then apply that research, that evidence to action. One of the things that is unfortunately the case still in many low-income countries, as well as some middle-income countries these days, is that they really have limited of their own research capacity. So they still depend on people from US, from Canada, from Sweden, and so forth to basically come in and do the research and then to tell them what they ought to be doing. The view of the coalition is that really we need to really support as much as we possibly can the research efforts of those in these countries to help them develop their own national health research systems, their own NIHs, their own funding organizations, so they can begin to do research focused on what they consider to be the priorities, not what NIH considers to be the priorities. And you see a lot of disjuncture between what Gates, for example, or USAID considers to be a priority in a place like Zambia and what Zambians consider to be the priority. And that mismatch, I think, is ethically problematic. So anyway, this led me to Western Province, Zambia. I was invited to join a group that was going out to a little town called Mangu. And it was there that we, again, in typical what we call coalition style, to sit down with our partners there in the local health system and say, okay, what issues do you face? What problems do you have? What can we as Canadians do in terms of connecting, because what we have access to is money, really, when it comes down to we have access to resources. Are there things that we can do to support your priorities in Western Province? And so we began to develop a number of different ideas about some programs to pursue. I was also fortunate enough to receive some funding to actually support some Zambian PhD scholars to come and study with me in Waterloo, again, as part of these efforts to develop research capacity. So this led to what we've called the Zambezi EcoHealth Partnership. And you'll see here a taxi cab, which is like many projects, it doesn't always start with the carefully considered review of the literature and it doesn't always start with a very sort of rational kind of approach. It often starts with conversations in elevators, and in this case, a conversation in a taxi cab. We were in Lusaka. I was with my colleague Chris Thomas, who is pictured here. He's a professor. It's actually a vice provost now at this university in Wales. And Andrew Silumesi, who you see up here on your right, who at the time was the provincial medical officer for Western Province. And we were all going to visit the Ministry of Health. And Chris said, I've been working in Tanzania on this project, and there's this new satellite system that the European Space Agency has launched. And this new satellite system has these really unique capabilities, and I'll talk about these in a moment. But one of the things that it can do is it can see through clouds and it can see water. And so Andrew immediately sat up and said, now wait a minute, this is really important for us because I live in a province that's dominated by one of Africa's major rivers that floods seasonally. And knowing what's flooding when actually turns out to be a critical problem for us, both in terms of restricting access to healthcare resources, for our teams, our mobile teams in particular, to know how they can get from one place to another, what roads are blocked, and that sort of thing. And so that really launched the Zambezi EcoHealth Partnership that I'm going to talk about tonight, or at least two dimensions of it tonight. These are some of the other members. There are many others, but these are principal members. So in addition to Chris and Andrew, Jennifer Liu, who's my colleague in the Department of Anthropology at Waterloo, Vic Neufeld, who's a retired physician from McMaster University and the founder of the Canadian Coalition for Global Health Research, Douglas Singini, who is a medical officer for one of the districts in Western Province, and Douglas is one that's probably going to be coming to Waterloo to join me to finish his PhD. Ndoye Muklabai, who is Vice Chancellor for Research for a little local university there in Western Province, and Corinne Schuster-Wallace, who is at the UN University campus in McMaster and is a water and health expert. So what's our big idea? What was beginning from that taxi cab conversation. In our conversations later with our colleagues there in Mongu, as we sat down in the provincial medical office and began to talk with people, it really began to crystallize. How can we apply this new generation of remote sensing technologies to understand flooding dynamics in this flood basin? And how can we couple this with understanding these communities and use this information in a way that strengthens health system, to really go beyond what had been done up to this point, really to capitalize on these new technologies. So there's many applications, I think, to of these technologies, and I'm just going to talk about two tonight that we've begun to focus on initially. One is about on malaria elimination. It's not eradication, but it's really trying to reduce the impact of malaria in terms of mortality and morbidity to a manageable level. And the second on maternal and child health, and in particular access by women to skilled resources for labor and delivery. Another photo of our team, actually after one of our meetings at the provincial medical office. So just to pause here to talk about the importance of this kind of work more globally. Gates Foundation, for example, has begun to put a lot of money into thinking about how can we increase the use of these new technologies to go beyond the sort of normal public health approach to build data infrastructures which allows us to work at a much higher scale. That's really what Gates is interested in. He's interested in trying to bring some of these things to scale. And of course he's a computer guy, he's a technology guy, so this is something that he's very interested in. A number of other organizations have begun to put some money behind this as well. The Canadian Institutes for Health Research is about ready to launch a major initiative in this area, and basically what it amounts to is bringing things together like social media, some of these remote sensing technologies with these new satellites, various survey data sets that are available in many countries. The DHS, the Demographic and Health Survey, is something that's done every, I think, 3 to 5 years in many countries, provides a lot of data about what's going on at the local level. As many of you know who have traveled to places like Africa, just about everybody has a cell phone. Cell phone technology has rapidly developed. It's very inexpensive. How can we use this in a more effective way, both to generate information as well as to disseminate information? And this becomes an important part of the project that I'll talk about. So there's a lot of new information tools out there, and the real, I think the proposal here is that they're not being used effectively enough to allow us to provide for effective public health interventions. And so this is really part of this, what we're thinking about, and this is how I locate what we're doing. Now, I'm an anthropologist, I have to admit, and a lot of these technologies, I think about that, and I think, you know, this is all very interesting, but at the end of the day, you still have to understand how someone in a community gets this information, how they communicate this information. Is it through a cell phone? You know, how are decisions eventually going to be made at a household level? So I don't think we can't lose sight of that. So the challenge really becomes, how do we merge big data with continuing need to work at a community level? So here's our approach. This is the technology. So the satellite system that I referred to is called the Sentinel system. It's part of the, as I mentioned, was launched by the European Space Agency beginning 2 years ago. There are two major satellites, Sentinel-1A and 1B. 1B, I think, is just about operational. Sentinel-1A came online just last year. And these basically are polar orbits. And they go like this, and it's a little bit like segments of an orange as they circle the Earth. And so, and they're taking sort of images in these swaths as they go through this polar orbit. Now, they use microwave radar. And for those of you who don't know how microwaves work, microwaves work actually by exciting water molecules. And so what these microwave radar systems do is they send these beams down and then wait for the response. And based on the nature of the surface that they hit, whether it's liquid or non-liquid, returns a different signal. So it's complicated sets, large amounts of data, but with some interpretation, you can actually see where water is. And because Sentinel satellites can see through clouds, they can give you real-time information during the monsoon season. So if you're in parts of Africa, parts of India, Southeast Asia, there are parts of the year where if your standard optical satellite isn't going to be able to see through clouds. You don't know what's going on under the clouds. But the Sentinel system, you actually see through the clouds. So all of us are being bombarded with microwaves every once in a while. So that's one of the things you might conclude from this as well. The data are made available for free by the European Space Agency. They're desperate to have people use this information, so they bend over backwards to make it available. It's terabytes of information really on a daily basis. So it requires essentially downloading this information, applying algorithms to it to extract the relevant information. And fortunately, our colleagues at Wales, there's enough kind of big data computer geeks there that have been able to figure out how to do this. So it's essentially automated now. So every time there's a data dump, it gets essentially extracted and then reproduced in the form of just simply a map, your basic GIS map that shows here's where the water is. And some details there on resolution. It's reasonably high resolution, as you can see. So some advantages and disadvantages. It's active, as I mentioned. It's weather independent. And it can also not only penetrate clouds, it can also penetrate forest canopies. And as I mentioned, because of the large amounts of data, it is somewhat difficult to process and also somewhat difficult to interpret. It's taken our colleagues in Wales several years to sort of figure out how to interpret some of this information, but they've been successful in doing so, and I'll show you some of that in a bit. So that's the technology. So let's then think about the place. So Western Province in Zambia, and Zambia is shaped a little bit like a butterfly. You've got the Congo to the north, you've got Angola to the west, you've got Namibia, Botswana, Zimbabwe, Mozambique, Malawi, and Tanzania. So it's right there in kind of south central Africa. The Zambezi River you can see coming down the west side, and the circled city there, Mongu, is the capital of Western Province. So the floodplain is basically about 30 kilometers wide on each side of the Zambezi River there as it flows down through Mongu. And it goes through a natural flood and drought cycle. There are no dams on the Zambezi above. There are below, which create the Lake Kariba there, Kariba Dam. The Zambezi is also for those of you who've been to Victoria Falls, that's the Zambezi River. In any event, it goes through a natural flood and drought cycle. And this has sustained an enormous amount of biodiversity. So if you have the flood, there's a silting, the water recedes, you have relatively fertile floodplains. For many years, the floodplain was one of the breadbaskets as well as the major producer of beef cattle in Zambia. That's changed for a variety of reasons. It's no longer quite as productive. But it's really sustained a cultural system. The local tribal group there are the Lozi. And they have a whole cultural system that's really adapted to seasonal flooding. So moving up high during the dry season, moving down low in the dry season, moving up high in the wet season, exploiting the ecological system at appropriate times of the year, cattle down low, fishing, so these people are relatively well adapted. They understand flooding. But what has happened is that with climate change, you're beginning to see what you see in a lot of river systems is increasing variability, increasing intensity of drought cycles and flood cycles, and not always predictable seasonal patterns that they're used to. And that's one of the things that we're particularly interested in, and that's one of the things our partners are particularly concerned with. Here's just a Google Earth image. The floodplain is called Barotse or Barotse land. You're not supposed to use the term Barotse land because there's an active independence movement. The English, when they were the colonial power there, recognized the king and gave him some limited authority over these lands. There still is a king of Barotse land. But using the term Barotse land is sort of a code word for an advocate for Lozi independence. So one has to be a little bit cautious about this. But in any case, this is the floodplain, the Barotse floodplain from space. Again, this is the river here going north and south. It's a very flat plain. There's relatively limited elevation difference. So when it floods, it spreads out a long way. It's a little bit like what happened in Houston after Hurricane Harvey. There just isn't much elevation difference. So water goes a long distance. It's very sandy, and this poses some challenges for things like sanitation. You know, it's really hard to build a pit latrine because they keep collapsing, right, because of all the sand. So that's a whole other project that I'm not going to talk about tonight, but that is an important concern as well. And to the south, so you have this big flat sandy floodplain, but to the south there are these outcrops of basalt that are really resistant to the river flow that constricts the river channel, becomes quite narrow with big rapids and that sort of thing. But what that means, of course, is that it's a natural damming function, so it pushes the water or keeps the water, allows it to spread out upstream. Malaria is endemic throughout the region and the country as well. And in the floodplain, it's actually quite spatially heterogeneous. So you have hot spots of malaria outbreaks. Some areas tend to be relatively protected from malaria someplace, and this appears to be moving around and changing. And so one of the problems is, can we use this technology with some hydrology to know where the water is going to come so that we can predict where these hot spots might appear and then intervene as appropriate. So just some photos of what the plain looks like. This is more in the dry season. You get a sense of how flat it is and some maize growing. In the dry season also, people come down to the river where they fish, and so you see a lot of temporary camps. So this poses some challenges, and I show this just simply because as an anthropologist, I'm always the one that, on the team that has to raise their hand and say, no, wait a minute, people just don't stay in the same place. They move around. So if you're going to think about malaria, you know, you've got the mosquito, you've got the community, but the people in those communities move, and then they come back. And that's a really important thing to understand when you need to contend with malaria transmission. So again, it's trying to build in some of what we understand about what happens on the ground with some of this remote sensing technology. A few vital statistics about Western Province. 83% of the population live on less than $2 a day. It's the second poorest province in Zambia. Maternal mortality rate, about 600 over 100,000. It's one of the higher rates in Africa. Neonatal mortality rate at 40, and you'll see the statistics there. So these are all indicative of a kind of low-income setting of poverty, of lack of access to resources, relatively poor public health, and continuing epidemics of various kinds of parasitic and infectious diseases, along with actually the appearance of things like diabetes and cardiovascular disease more in the urban centers. So you really have a dual burden in the rural areas of infectious disease and also malnutrition of children, and then you've got now increasing rates of chronic disease appearing, very high rates of hypertension, for example, we found just in Mangu. Very high seroprevalence of HIV, and I think this is important as well. About a seroprevalence rate in adults of about 15%. So this is very, very high. And this is an area where there's a lot of money that comes in from the U.S. government through the President's Emergency Fund on AIDS relief. Getting antiretroviral therapy out to these rural communities is a real challenge at some times of the year. And again, this is something that if we could understand what the barriers are at certain times of the year, that might facilitate actually getting those drugs out. And a lot of these drugs are sensitive to temperature, especially the oral medicines that are used for children. So they're temperature and time sensitive drugs, and so access to these kind of drugs for this population is very important. So a little bit about the health system. It's very typical of former British colonies in terms of how the health system was built out. You have health posts and health centers at a community level. They look a little bit like what you see here in the photo. There's about 150 of those, and they're scattered about. And it's not always clear to us that these were really positioned very rationally. And this is one of the, without some thought about flooding and so forth, because some of these places just flood during the rainy season. And this is one of the things our partners are very concerned about. And they're thinking, you know, if we had some of this information about flooding, we would know where to put health posts. It's a pretty simple problem, and it's surprising that they didn't figure, they haven't been able to do this until more recently. So some district, there are 13 districts now. Those are increasing to 7. Each district has a hospital with a few beds, and then there's a provincial general hospital. All the tertiary care in Lusaka is mainly in Lusaka, some up in the Copper Belt. But essentially you have a provincial hospital that can do most basic surgeries and that sort of thing. Staffing is a major problem in the health system. Many of these health posts are understaffed. They're supposed to have a clinical officer, a nurse, public health specialists. Public health specialists are usually responsible for ensuring adequate supplies of clean water from the boreholes and making sure there aren't any issues with sanitation. But typically what you find is maybe a public health person. Usually somebody who cleans the place is there. Sometimes a nurse, sometimes not. But only about half of these actually have any staffing of a clinical officer. No physicians, but it's kind of that mid-level medical professional they call a clinical officer. So staffing is a major issue. So it's one thing to say, okay, do people have access to a facility? It's quite another thing to say, is there anybody there? And so understanding the nature of these facilities and their capacity to actually provide services is another issue that has to be joined with some of these GIS technologies. So our initial question was this, and this is about, initial question about malaria as well as access. And there are other things that I mentioned that we're interested in, but these are the two I'm going to talk about. So our initial question was this, that coupled with an understanding of how water flows through this flood basin, this hydrological data, can we use these satellite remote sensing systems to generate flood models that are usable by local people? Now, it's one thing to have them usable by computer scientists in Wales. It's quite another thing to make sure that the information you have are easily accessible and usable by local decision makers. So it has to be something that can just be dumped into an open access GIS that anybody can use, or into Google Earth and so forth. So if we can do this, if we could give this information on a real-time basis with some limited predictive ability, because you can measure rainfall upstream, you know water flows downstream. You say, if we give people this information, can they act on it and effectively enough to actually both plan health services as well as deliver essential services to those who need it? The second question is, that I mentioned, and then is it possible to predict or rapidly identify malaria hotspots in a cost-effective way? So I mentioned these malaria hotspots tend to move around. They're quite heterogeneous. We think that, or we hypothesize, and I'll show you the hypothesis in a moment, but the formal hypothesis, that the way these hotspots move around is really linked to these hydrological events, so that we have water come down that stagnates around human settlements, so that you have the humans, you have the water, you have the mosquitoes, and that these are variable by season, these are variable spatially and so forth. So if we know the things that predict these hotspots, then that gives us the ability actually to intervene and intervene in a cost-effective way. Because you can go out there and you can give 1 million people bed nets. Some of them will be used, some will be used to fish, and so other things. And you can go out and spray the entire environment with pesticide. It's cost effective, maybe not effective epidemiologically, but if you could identify these hot spots just even a couple days in advance, and then focus your intervention just on those hot spots, both in terms of treatment, in terms of bed nets, in terms of larvicides in the water, interior spraying, and that sort of thing. You know, can you really make a difference? And that's really the key question of the malaria study. And of course, there's other outcomes, as I mentioned. So I don't know how much all of you know about malaria. I thought I'd throw in this slide just to remind us exactly what the disease is. It's a vector-borne disease. It's transmitted by a species of Anopheles mosquito. There are 4 species of parasite. The only one we're really interested in here is Falciparum, which is the one that tends to be deadly, or certainly the most serious. It's vector. The incidence of disease is related very clearly to the abundance of mosquitoes in proximity to susceptible human hosts. Malaria does produce an immune response, but it's sort of attenuated by time, so that you have to be constantly infected by malaria in order to maintain some kind of immune response. And this is actually quite interesting, because what that means is that those who haven't been exposed, young children and so forth, when they get it, of course, they don't have an immune response. They get a much more serious form of the disease. They're much more susceptible to severe morbidity and high mortality. And also pregnant women are also susceptible, more susceptible as well. In fact, in this part of Africa, about 20% of maternal mortality is likely linked to malaria. So floods are an important driver of vector abundance. That, I think, is a fairly straightforward relationship. And then I mentioned the usual methods that are used for control of the disease. So the theory behind this, just very quickly, here is that most attempts to really try and model malaria transmission across large landscapes up to this point have been relatively simplistic, based really on rainfall, because you can often get rainfall measures and then try and predict on the basis of rainfall. But floodplains, of course, are independent of rainfall. Particularly in the Zambezi, the rain can often fall up in the Congo, and then you're seeing it 2 weeks down flowing into the Zambezi. It may not rain in around Mongu at all. So rainfall isn't a very good predictor. You really need to understand the flood dynamics. And then it's also, of course, critical. It's not only the water that's important for malaria. You have to have humans. They're part of the system. So it's water in association, water that comes in that's relatively stagnant, at least over a 2-week period, enough time for the mosquitoes to reproduce, and they have to be close to a population. And so those are the key ingredients. So if we kind of move beyond these simplistic models and then look very carefully at where the water comes, where it is in proximity to humans. And then there's some other fancy mathematics you can do with agent-based modeling and that sort of thing to sort of predict where you're likely to have the greatest transmission events happen with mosquitoes. Then that might provide us an opportunity to intervene. So a bit about the previous work that Chris Thomas and his team, our colleague from Wales, did quite a bit of work on vector ecology in the Gambia, and then moved on to Tanzania, the Kilimanjaro Valley. And there he uncovered key relationships between rainfall, seasonal surface water, and larval abundance. And I think that was really the genesis of his interest in the Zambezi area. And this, I think, will give you a little bit of a kind of a swoop in of the Ifakara region. And you'll see here that the blue is new water and the red is water that's 2 weeks old. You'll see there's Ifakara right there. And these are from the Sentinel-1A satellite images that have been interpreted. So you'll see here, where the red is, this is old water. And so the issue is, okay, if you have red water, where are these in relationship to human settlements? And where you have a high concentration of people with old water, then what they were able to demonstrate is you had much higher vector abundance. So there are many more mosquitoes and much higher rates of malaria transmission. Now if I can get out of this, oh wait, there we go. So anyway, they concluded that the radar from the Tanzania study is a good basis for identifying larval hotspots in large rural areas. And so then the issue is to try and refine some of these models to become even more sensitive to flooding. And the issue, of course, is that satellites are snapshots of just what's happening now. Really, the issue is what's happening now is less important than being able to predict. If you can predict a couple of weeks in advance, and that's where you build in understanding of hydrology, of how water flows through a water basin, understanding the elevation of the basin, where the water is going to go, where the lower spots are. And if you can build that information, you can join that information with the satellite data, that gives you much more of a dynamic view of the environment. So this is the hypothesis. And I've already sort of gone through this, so I won't repeat myself here. So these are the current efforts. So this is currently ongoing work. This was funded by the Environmental Sciences Research Council in the UK, major investment on the part of the Research Council. And so we're now working to sort of generate our elevation maps of the basin. Chris and his team are actually flying drones across with permission from every local village, which takes a lot of time, but flying drones across the valley, doing radar mapping so we can see the elevation differences, and that's really critical to understanding where the water is going. And then working with some hydrologists to do some flood prediction modeling and some of the dispersal simulations, and this is where you get into the fancier mathematics. For those of you interested in agent-based modeling, it's actually fairly simple from a modeling standpoint, and it's really just simulating where mosquitoes would go in, would fly 50, half a kilometer here, half a kilometer there, in relationship to human settlements. And then my interest here as an anthropologist to say, okay, this is all great, but again, what's going on at the community level? How are they, what are their activities in relationship to water? Are they going down to the, if they're going down to the river or they're going to fish, they're leaving that community and they're going somewhere else. And we know very well from malaria epidemiology is they can actually be infected somewhere else and bring that parasite back and actually infect the local mosquito. So understanding some of those transmission routes adds a whole level of complexity, but as an anthropologist, that's the kind of complexity that I really like to add to these kinds of things. But as you think about it, what human activities don't involve some kind of interaction with water? And particularly in an area where you've got a floodplain, where you've got rivers, where people fish, and so forth. Tremendous number of human activities are involved with washing, bathing, swimming, fishing, being in proximity to water in one way or another. So understanding those behavioral dynamics are very important. And finally, it's also important to understand how local people think about malaria. They have a lot of experience. They have many, many generations of experience with the disease. What's their perception of risk? What's their level of traditional ecological knowledge about what happens? Because my guess is that they probably have a pretty good understanding as well of what these dynamics are. And that's an important, I think, bit of information to add to these some of this remote sensing models. And you can see this very well. It may seem relatively straightforward to say, okay, here are the floods, here are the communities. But when you actually go and try and map where the communities are in relationship to all these things, you realize that it's a lot more complicated. So all these little red dots, this was actually a student project, went through satellite maps and digitized everything that looked like a building. And these are just things that can be seen. This is an optical image, not a sentinel image. So these are may all in fact be settlements. So that's a fairly complicated array to think about in relation, and these are all in a floodplain. So which ones of these are going to be high risk and not? I mean, just trying to sort out some of the complexities here, I suspect is going to be somewhat of a challenge. So that's malaria. And that's a study very much in progress, and it's something that will be ongoing for a couple of years. The one thing that I was particularly interested in, and that our partners were particularly concerned with, was the high rates of maternal mortality and the degree to which flooding acts as a barrier to access to health resources. So it was something that and it's work that I've actually done in Mongolia. So I was very interested in kind of working with our partners there to think about, again, how do we use this? Is this technology useful at all? You would think that if you could identify barriers, if you could identify where floods are blocking roads, where people couldn't get from one place to another, especially if that place that they need to go to provided the services they needed, you think that that would be important. But the question is, what do we know about it? Can we identify what those relationships are? And if we can, then how do we make things better? Now, just as a reminder, maternal mortality, again, a little bit like Malaria 101, maternal mortality 101 in a very kind of summarized way. Maternal mortality is typically an emergency condition. The main causes are hemorrhage, which is excessive bleeding, leads to hemorrhagic shock, death, stroke, and so forth. Eclampsia, eclampsia, which is pregnancy-induced hypertension, which can lead to dangerously high blood pressure, which can lead to stroke and so forth. Stillbirths, in terms of neonatal health, failure to resuscitate, and so forth. In any case, there's a whole host of conditions here, but they tend to be emergent. In other words, they're hard to predict. There are some risk factors, but often when a mom comes in and some of these things can happen, and they can happen very quickly. They're hard to anticipate, and often there really needs to be some kind of very quick response. Now, the model that's used internationally to understand some of the factors that lead to high rates of maternal mortality, this has been around since the 1990s. Deborah Main and her student, a medical anthropologist, identified what they call 3 delays. And each of these delays, sometimes in combination, sometimes one or the other, can actually impede getting a mom to the services that they need to deliver safely. The first delay is just making the decision. So in places like Zambia, many parts of Africa, for example, where you have high rates of home birth, where facilities are a long way away, or the perception by the community is that those services are not very effective, or there may not be people there to help, a lot of birth happens in the home. And it may be assisted by a traditional birth midwife, by an older woman in the family, and that sort of thing. And in probably most cases, as humans, we survived a long time without obstetricians. Things are fine. Nothing goes wrong. But in some cases, of course, things don't happen as quickly as they should. Labor goes on, it doesn't proceed. At some point, somebody needs to make a decision that help needs to be sought. And so who makes that decision? How is that decision made? So that first delay can just be that delay in just making the decision to find and go for help. The second delay is actually getting there, right? So once you make the decision that you need help, then you've got to find transportation. And someone has to get you from where you are to the facility that can help you. And of course, if you've got floods blocking the road, or you need a boat to take you somewhere, well, then that becomes an important problem. The third delay is that once you're at your destination, you may be delayed in getting the care that you need because nobody's there. In Mongolia, when we're doing this kind of work on maternal mortality, just each story is heartrending. And it's often a combination of these factors. You know, there's a delay in making a decision. You know, the ambulance is out of gas. They finally get to the clinic. Nobody can find the physician because the physician's gone out somewhere else. You know, there's all these things that tend to sort of all come together and lead to a really unfortunate outcome. So the question here then is, in the Zambian case, again, using this technology, if we can identify where there are floods and predict where there are floods, can that help us reduce some of these critical delays, particularly the delay of getting from the home to the facility? Now, for those of you who've done, you know, GIS work, you'll know what they'll talk about friction surfaces and things of that sort. And basically, it's a fairly simple problem spatially. It's just really identifying where the barriers are and how to get around them. It's a little bit more complicated in low-income countries because you don't have any data. You don't have any road data. You basically have to send teams of local people out there, community health volunteers, and that sort of thing, to map your routes so that you understand what the routes are, and then build those into your GIS. So the question then, and it's the one that we're actually developing a project now with our partners, is to do just this, to really, you know, develop these GIS systems to identify where some of the barriers might be, and then to follow through to then ask the applied question, is, you know, the so what question. Okay, we know that there are barriers. Is there a way that then we can communicate this information in a way that would allow, say, a community health volunteer who has a cell phone to know where to go if there's an emergency condition, or where they can get that kind of information in a relatively easy way? So some of my colleagues who are health informaticians and so forth have all these great ideas about simple apps that can be used on phones and that sort of thing. I'm not sure that's really necessarily the way to go here, but with cell phones and with cell phone technology, just the ability to get information out to communities very quickly, say, okay, the flooding has affected this route, the flooding has affected that route. So someone who, you know, and all of these communities, most of these communities do have community health volunteers. Getting them that information can be life-saving, and so that's one of the that's what we hope to be able to investigate and to provide. I did mention that the other issue here is that we also have to know what happens at the facility level, because it's not just about identifying barriers, it's identifying what services are available. So it's that adds, I think, considerable complexity here, because you can actually identify a route from your home to the nearest clinic. Again, simple GIS problem. The problem is if there's nobody there at the clinic, then it's no longer a simple problem. So you really need to have some built-in information. And this is actually something, interestingly enough, that the DHS system is now being able to do. They're doing assessments of capacity. The problem is they don't do those surveys often enough. So it's probably for what we're hoping to do, we're going to have to be doing these facility assessments on a relatively regular basis so that we can maintain updated database of what facilities can provide what services, so that when the decision is made to seek those services, they're going to the right place, and that we can help them get to the right place. And as I mentioned, the possibility for low-cost text-based apps to deliver some of this information, that might be possible. I don't really know, but would be happy to discuss it with those who know a little bit more about this than I do. So that's just kind of a summary of what I've been doing and our team has been doing in Zambia. Just a summary of the core idea here and how we think it might help. And this, I have to emphasize that this at this point is really these are research questions. These are questions to ask whether there's sufficient evidence for us to go to the next level, which is really to look at interventions that are effective in both addressing malaria as well as reducing problems associated with not being able to access the services that are needed for certain important conditions. I should also mention that everything we've done is all open access. We don't use ArcGIS. We use QGIS, which is an open, I encourage all of you to look at QGIS, which is very much like ArcGIS, but it's free. Right? So there are all these platforms. You can use Google Earth Engine. There are a number of free resources now that can actually, QGIS is good, and also Google Earth is good because these all can be run on fairly low capacity machines with limited bandwidth. You don't need a lot of computing power. And so, so even though on the input side, the technology is relatively complex and the data management problems are relatively complex, the output is actually, the goal has been to make it really quite simple and quite easy to get access to so that somebody sitting in the provincial medical office can turn on their computer, open up QGIS or Google Earth and say, okay, here's where the water is now, here's the prediction for flooding over the next week. What kind of decisions now do I need to make based on that information? So, thank you. Discussion, questions? I know this is a lot of information, and a lot of it is kind of in process projects, so I can't give you any final answers into whether any of this stuff works. But we're hopeful. Yes?
Are there other groups out there doing similar research that you found out about or talked about that are trying to use GIS in a similar way?
Not with the remote sensing stuff. There's been a reasonable amount of work in the past, I'd say 10 years, 8 to 10 years, applying GIS to understanding access to healthcare, particularly around maternal health. And so there has, and the evidence suggests that, yeah, we can identify barriers. The barriers make a difference. You know, where households, where women are at a greater distance and where that distance is impeded, where the routes to healthcare are impeded, it does appear that there are higher rates of adverse outcomes. These tend to be relatively static kinds of analyses. They're based on survey data. So there's nothing that's been done that's dynamic, that's attempt to really predict difficulties with access. They've been looking at past events rather than really trying to predict in a longitudinal, in a dynamic sense. The best work that I've seen has been just done over the last couple of years with funding from Gates and USAID, I think, in Malawi, and they've looked at seasonal access by women to essential services. But again, they haven't used this particular satellite system. They didn't have access to it. They were just using rainfall as a proxy measure to try and get a handle on what times of the year might be most difficult, and then to focus on those difficult seasons and those difficult routes of access. Yes.
Just from my experience, floods can be totally catastrophic over there and interfere with everything.
Yeah.
So I can certainly see a potential for anything that helps manage floods to have broad impact on health and education and commerce and all those things. But you have a lot of steps from the problem to evidence that you've had a positive impact.
That's right.
You first have to get this whole sensing system to work in a timely manner.
Yeah.
Then the whole thought of a rapid response system for bed nets and social change and community health workers.
That's a lot of moving parts.
Yeah,
a lot of moving parts.
That won't be a quick response.
No. Yeah,
So I
you're
think
right.
it's a wonderful effort.
Yeah.
But in terms of getting people to fund it, you're a while away from having results, I would think. Yeah.
Yeah.
So you got a challenge here.
Yeah, no, it's a very good point. And at the end of the day, the way I think about this is it's really just another it's another bunch of information, right? It's another bunch of information that can be communicated. And there are a lot of things that happen, of course, you know, do people act on it or not, and how do they act on it? Is the way they act on it, is that appropriate or not? But really fundamentally, it's a health communication kind of an issue. You know, sort of, if we could actually figure out if there's some really critical points, I mean, that's the malaria hotspot study probably is a little bit closer because that's, you know, we understand the vector ecology, we understand the disease reasonably well. So the potential there for getting and communicating that information. But you're right. Are you going to get bed nets there? The bed nets are probably already there anyway.
Yeah.
Are you?
If you get there.
Right. Yeah. So yeah, you could probably get the funding to go out there and experiment, to do the trial. The trial will be successful, but does that really translate into interventions at scale, which is really what you
10
want?
years
Right?
from now, it might have
Yeah.
a huge impact.
Yeah. Right. Exactly. Yeah. So I think question there, and then Peter.
Thank you. I was wondering about the role of floods. What I couldn't really understand is whether flooding is really creating a condition for malaria to breed. The fact that floods, certain seasons can be barrier for transportation,
Yeah.
I can understand that. But again, that is very much seasonal,
Right.
something that can be managed and controlled. But flood, what I couldn't really understand is the role of flooding as a cause of, that was one of the arguments. No, sure.
For the malaria, you mean?
Yes.
Yeah. Yeah.
Yeah, because flooding in fact is going to be, very good to wash away,
Yeah.
the basins and
Right.
so on. Obviously, common sense knowledge is that malaria breeds where the water is stagnant.
That's right.
So maybe rains causing ponds here and there,
Yeah.
and in an environment where malaria actually breeds can be the cause, but flooding,
That's right.
it's really.
Yeah. 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 You're right. You're right. Moving water is not the problem. It's really stagnant water. And so I think what the hope is that these models will allow us to identify places where the water stagnates. And again, if it's seasonally variable, we can't predict every year that this particular place is going to have stagnant water. And so I think that the idea is that it's really not the flooding so much, it's just simply about water moving through the ecosystem and stagnating in certain places near human settlements. And really trying to be able to identify that relationship. Yeah. Yeah. Thank you for, it's an important point. Peter.
I think that what you're trying to do here is very interesting in the sense that you're trying to connect technology and anthropology. And but I'm wondering, they don't seem to be in sync quite.
No, not yet.
And the key thing, it seems to me, from what you described, but I might have misunderstood this, is real time versus, why don't we say, anthropological time. So the technology is all real time.
Yeah.
But the problem with anthropological time is mobility.
Right.
That you're sending people out to find out if there's a hut here and a hut there. But that might not be there, or if there's a fisherman here or a fisherman there. But that might not be there in the real time that the technology is dealing with because of this mobility
Yeah.
factor that all human beings engage in. So
Yeah.
how do you bring those two together?
Well, it's a good question. I don't know the answer to that at all. And this is my nagging criticism of this, because I think there's often an assumption by our investigators who are ecologists. They're thinking it's great to model a system, but you have to assume that you can understand the dynamics of that system. And I don't know that the dynamics of the system on the human side are particularly well understood at this point. Now, the potential is you could say, okay, well, the pattern is that in this part of the floodplain, at this time of year, people tend to move from here to here. If it's a regular pattern, then you can actually you can build that into your dynamic models. But if it's not a regular pattern, if it's a random pattern, or it's variable, then I think it becomes very, very difficult. And I think you're absolutely right that they're not in sync. And you can't, I think the hope of some members of the team who are doing the remote sensing stuff is that once we get all the models figured out, then all we have to do is push a button, and it'll all just, we'll be able to look at this entire, ecosystem 30 kilometers wide by 150 kilometers long, and be able to predict where we need to go. What the assumption is that humans will behave in a patterned way, in somewhat the same way that the water does, or that it can be modeled. But I'm not sure that it can.
Yeah, I just saw something else, though, that might be a promising approach, and that is the technology of cell phones.
Yeah.
I mean, you can't send an anthropologist out to each of these hotspots, or each of these health centers to see if there's anybody standing. But you could have a network of cell phone coverage that would be real time.
Yes.
And that might be.
Yeah, and we've talked about that. And there's also some groups that have used just GPS units and put them on the back of scooters that the health workers use. And you kind of put it in a map, and you can just see where people are. Now that's just for identifying pathways. But yeah, we have talked about the cell phone coverage, because you can probably, where the cell phones are, and where people move and that sort of thing. Now that's huge data. That requires, a lot of computing power, but people do it all the time. So it's possible.
These hotspots that you find, how many of them actually have malaria, or how do you determine that? Seems to me you'd have a lot of false positives from your point of view. You go out there and do all this, and then there's no malaria.
Yeah, it's possible. I guess we don't know yet. The prior work that Chris has done has suggested that vector abundance in proximity, within a half a kilometer of human settlements, adjusting for density and so forth, is a pretty good predictor in an endemic region of malaria. Now they will do some, they'll do some additional testing and that sort of thing. And some genetics of the parasite and that sort of thing, but as part of this whole process. But I think that's part of the research that they're hoping to do, is to provide the simulation and then to see whether it works or not. And whether it works or not is really determining whether the mosquitoes in fact have the parasite, whether the malaria is in fact in the humans, and whether you see the incidence rates that you would predict.
How often does this satellite collect data from this region?
I think it's every it's a good question. I think it's on one of the slides. I want to say every couple of days. I think it's fairly recent, and there's 2 of them now. And if you make and it's not taking an image of every single square centimeter of the Earth's surface. You have to, it'll skim over some things without gathering a minimum of information. But if you ask them and you say, "Can you focus on this?" they'll do it, and so that's what they've done here. So they're getting a very high-resolution image of this area every couple of days.
Greg, how big, we're talking kind of a valley, this fixed valley. What number of healthcare workers or outposts are we talking? 7? We're talking number 17 or something?
Well, there's a total of 17 districts, but in terms of the flood-prone regions, you're talking probably about half those. And so, probably half a dozen district hospitals and probably another 40 or 50 health posts or health centers.
It does seem like the cell phone is the link to real-time human behavior and communication.
Yeah.
And, it's, if the health provider has a phone on them and is not at the facility, they can communicate that.
Yeah.
And the doctor is in, the doctor's out.
Right.
It's almost the Uber interface of where are the healthcare providers based on then how do I get to them the most reliable route.
Right. Yeah.
I think the cell phone is the key
Yeah.
to,
Yeah. I think so
to the
too.
people.
Yeah.
Wow.
Any questions, comments? Yes.
Can you put a visual of Zambia will be open this kind of
See, I didn't quite hear you, sorry.
How well do you think we respond to kind of rapid intervention with this kind of information provided?
It's an excellent question, and it's one that I think has been asked at an institutional level and at the level of the Ministry of Health and the provincial medical offices and sort of those who are involved in delivering care. And of course, they're very interested and they're very receptive. And in large part, this is a response, in large part, as I mentioned at the beginning, to some of their priorities. But I think an important question is, what do communities themselves think about this, and how are they going to feel about suddenly, a bunch of people in kind of trucks and Land Rovers, showing up and suddenly putting BT into their water sources and doing all that kind of thing. And I think that's again, from my perspective as an anthropologist, that's a really important thing to understand, and to be able to communicate what's going on to local people, but also understand how they perceive risk. Because it may be something that they're not particularly keen on. Now, we've spent a lot of time talking with the Indunas, which are the chiefs, and so there's a king and chiefs, and the chiefs actually control the land and that sort of thing, and are important decision makers in these communities. So we have done a lot of that outreach, and they're of course quite supportive. But again, I don't know if that necessarily translates down to community levels in terms of their own understanding, their own support of these projects. But it's a very important question. And I answered it. Did I answer it? Okay.
How prevalent are cell phones currently in these communities?
Most of the, certainly all the community health volunteers and, those who have a formal or quasi-formal relationship with the health post and with government will have cell phones, the village, head person and so forth. So probably not everybody has a cell phone, but I would think that almost all of your health volunteers and so forth would have them.
So they're in the community?
Yes.
Even
Yeah.
if every community member does?
Yeah.
Even if it's not like the US where every household has one?
Yeah. It's pretty close though. There's the cell phone, the number of cell phones, I don't know what they are in Africa, but it's the rare person that doesn't have one, right? And they're not smartphones necessarily. So whatever you do has to be, SMS based. So you're not going to be doing anything sophisticated with smartphone stuff, but text-based applications would seem to work, to me to work.
Are you building the capacity of a university or
Yeah, so there is.
to manage this database?
Yeah, so we have there is a local university there. And they're building a second one. The University of Barotseland, and one of our partners is the Vice Chancellor for Research there, Vice President Research. So we do a lot of work with so they have a small public health program, a bachelor's program in public health. They have an environmental health, a science program. So we work with actually the students and the faculty in those two programs on this project. So they've been built into the project. And then we also do a fair amount, whenever we're there, we do a fair amount of lecturing and mentoring of students and faculty when we're there. So that's a big part of what we do. And
Where's the database? Is it going to be in Canada or in Spain?
that's a good question. I don't know. I would think that the satellite data, because of how just the size, will probably be maintained in the UK. But the idea is that I guess the reduced and more useful data would be local. Yes.
I was just wondering when this began and how long you anticipate carrying through this project?
Well, so what I talked about this evening, we began about 2 years ago, in our initial discussions with the provincial medical office. you know, the funding for the malaria project we just received last year, so it's, you know, it's all gearing up, and the grant proposals for the other part have just gone in. So, so it's really just really at the beginning stages of all this. How long it will last? That's a really good question. I don't know. You know, my probably lasts well beyond me. You know, my experience in Mongolia and my own preferences are that you stay, you know, you develop partnerships, and you develop those partnerships and those relationships, and you maintain those as long as you possibly can. So, you know, I've been working in Mongolia for 20 years. I have, you know, multiple doctoral students that I've trained that have gone back that are, and that we continue to collaborate on a number of projects, and we're doing the same thing here in Zambia. And so, you know, at some point I'll retire, but other partners are younger than I am, and I expect them to continue this relationship.
So publishing the results of your hypothesis, are you looking at 5 years from now?
Results, yeah. Well, that's a good question. I imagine probably initial papers will come out in the next couple of years. Yeah.
What's the state of the wildlife there?
Not bad. There's at the western edge of the floodplain is a national park, Lihue. What do they call it? Lihue National Park, and it has a huge wildebeest migration. A lot of wild dogs and that sort of thing. There hasn't been, to my knowledge, I know there aren't any elephants in that part of the floodplain. The elephants you see here are from Kafue National Park. So, you know, I guess I would have to say I'm not really sure. I haven't heard anything about, I haven't heard any negative reports about things like poaching and so forth. That doesn't mean that it doesn't happen. I just haven't heard anything about it. The Lihue is hard to get to, so it's fairly remote. You have to, the only way to get there is by boat or ferry across one branch of another river that flows into the Zambezi. So it's inaccessible. There are other parks nearby that are probably more accessible to people, and so it might suffer more from human presence. Anyway, I don't know if that answers your question. There's a lot of great wildlife, but how you know what it is in relationship to what it has been in the past, I don't know.
A little bit like the last question about the technology.
Yeah.
You know, obviously a ton of R&D went into that and launching these. What was their purpose? Why are these satellites up there? Is it off the water?
No, you know, it's actually that's one thing that they're doing. They're, you know, it's part of an Earth observatory system, and some of the things that this technology can do is sense very fine different changes in elevation. So I know that one bit of the technology is being applied to looking at earthquake and fault lines and movement along fault lines and that sort of thing. So, but there's a whole host of other things that I know that they're trying to build into these. It's really just a sophisticated Earth observatory system that adds on to what's already being done optically. So they're now able to do things with radar that gives them a little bit different kinds of information.
And they're friendly to uses. They like proposals.
Yes, yeah, very much so. Yeah, they put a lot of money into this, so they like to see people use it, right? Yeah. Great. Well, thank you.